So Mark, I would love for you to walk us a little bit through what your own journey was like. You have a tremendous amount of experience seeing patients, guiding them through the process of going through cataract surgery. And so I'd love to hear what was on your mind when you first got diagnosed with cataracts. What were you thinking?
Well, I knew that they were progressing slowly over a number of years, having colleagues check in on me and doing exams. But it was really after moving to Hawaii that it started to become a bigger issue for me. And Dr. Dirk Fuji, who's a family member, and my optometrist had suggested that it was time, particularly in my right eye, to have something done about it. So he had highly recommended that I'd come and see you.
Oh, well, thanks. I'm glad that you did. So tell us, before cataract surgery, were you nearsighted? Were you farsighted? What were you using your glasses for, and what were some of your activities that you valued?
So before cataract surgery, nearsighted, also presbyopic. So I was wearing multifocal lenses, about a -2.5 prescription for distance. Really was a full-time eyeglass wearer.
What'd you like to do in your free time?
So I like to play golf, tennis, go to the beach, kayak, hike, pretty much everything that you'd move to Hawaii to take advantage of.
Were your glasses getting in the way of any of that?
Absolutely.
They were?
Absolutely.
Okay.
Yeah. And contact lenses were also a challenge. You know, I suffer from a little bit of dry eye. So, you know, keeping those in, particularly in settings with wind, was an obstacle.
So when you came in, did you have a specific lens and a specific goal in mind?
We had talked about doing a toric implant in that right eye, which, to correct for the astigmatism that I had, would be to target a near distance like I was used to being nearsighted. So computer use, especially in a work setting, I thought that was going to be where I would want to stay after the surgery.
Yeah, and that made a lot of sense. I think that's a really reasonable plan. And one of the things that I like to do is give patients all of their options and kind of nudge them towards what I think might be best for them, but obviously let them choose what they want. And with you, as I was listening to you and I was listening to what your activities were, what your hobbies were, how you were using your eyes in your clinic setting, I thought, wow, this is a person who really could benefit from a light adjustable lens, because it gives you the chance to really fine tune where that vision is and where you want that focus point to be. And so that was what I recommended to you and I brought up to you as something that I thought might be a little bit better option than just a fixed power astigmatism correcting lens. What did you think of that plan? Was it something you'd considered?
I had never heard of the light adjustable lens before meeting you, but once you discuss the technology and its benefits in terms of ending up at a different endpoint than what we might initially target, that certainly seemed like it would be a great option for me, and that proved to be the case for sure.
Yeah. It's normal to be nervous when you're going into any kind of surgery, especially somebody who's been around a long time and seen many, many cataract patients. You know, the overwhelming majority of cataract patients do well, but I'm sure there was maybe a little bit of a seed of doubt in your mind, even with, I appreciate, you know, confidence in me. So tell me, how did the light adjustable lens factor into your nervousness? Did it make it more or less? Did it ease some concerns you maybe had?
It eased the concerns because I knew wherever we started off, that wasn't the final endpoint, and that we're going to have multiple options at that point to consider. If our initial target allowed me to see better for distance, for example, then we could reassess at that point.
So what was your experience after the first eye was done?
Well, certainly the first couple of days after the surgery, I was amazed with the lens. I could see from, you know, quite far away. So that was remarkable.
Yeah.
What was a surprise, though, was the difference between the eyes immediately became an issue, particularly when driving. And I think I called you and said, "Uh-oh, I know you're going on vacation next week, but maybe we can consider having this other eye done." That wasn't something that I had anticipated going into the surgery at all.
Yeah, yeah. And it can definitely happen, I think, especially for people who are very perceptive. But I have patients routinely notice that there's some color difference or size difference or image quality difference that makes them want the second eye, which I think we had talked about before surgery was something that really made me more comfortable recommending light adjustable lens for you, knowing that there might be a chance you'd want to do your left, and having the flexibility of where we go with your right will just leave more options open for you when we do the left.
And I think that after we did that first eye, we were able to almost immediately make a decision to target the same endpoint in the left eye, and then most likely adjust for distance at that point.
Yeah, which was, I think, a little bit of a surprise to us both. Yeah.
Yeah,
And yeah, so that's what's so fun about this, is that you get to choose. You get to drive the conversation of how you want to see after surgery, and you tell us what you want, which maybe you didn't know when we started the process.
You'd think I would, as an optometrist consulting with patients for all these years, and watching outcomes, but even I was surprised how caught off guard I was.
Yeah. Well, I'm definitely glad we had the ability to adjust, since you kind of changed your mind after surgery.
Yeah, absolutely.
So now that you have great distance vision without glasses, tell us, what does that mean for you? What is life like without having to be totally dependent on glasses and contacts for distance?
So for distance, it's wonderful. For example, the distance at which we're talking, you're perfectly clear, and that's not something that I would have expected with a monofocal, just a distance prescription in the implant. So it's been a nice surprise. So it turns out there's very few settings, some of which are lower light restaurant settings, smaller details in a work setting with patients up close, where I'd need to wear a reading prescription. But other than that, when I'm out and about, even glancing down at my phone with good lighting, intermediate conversational distances around a dinner table, there's not a need to wear a prescription.
Yeah, and you're able to, look around and enjoy our beautiful world and see
absolutely.
super crisp detail far away. Yeah. Yeah, we're lucky. We live in a beautiful place where distance vision's really pretty nice.
We'll see if it helps my golf handicap.
Yeah. Yeah, I hope that it does. How has it been golfing and hiking with your perfect distance vision?
It's excellent. It's a very different experience than, the last 57 years. And at this point, you'd never be able to get me to trade it away.
Yeah, that's awesome. Yeah, so, you had a phenomenal outcome. So Mark, one of the key things that I learned through going through this journey with you was just how powerful it is to actually have adjustability in a lens. So we think we know how to counsel patients and help guide them to a decision that's going to make them happy. And we think that we can have all these conversations about, how you see now, how you want to see after surgery, but it's really all an educated guess at the end of the day. And there is no substitute for a patient being able to choose how they want to see after these lenses are already implanted, because you had all the best information in the world. You knew everything about yourself. You knew everything about cataract surgery and lenses and optics, but you were still surprised and chose something ultimately very different than what you thought you wanted going into this process. So I love that we've been able to go through this together and learn that you might change your mind, and that's okay if you have an adjustable lens.
And for me, the takeaway was much the same as yours, which is I thought I knew what I wanted going into the surgery. It certainly wasn't what I ultimately opted for, and the only way to be able to get to that outcome would have been to have the light adjustable lens.
It's hopefully been well worth the process.
Absolutely.
Yeah, well, thanks for trusting me to take care of you.
Of course.
Yeah.
It was a fantastic experience. Your office staff, you, the lens, all were top notch.
It's been fun going through this journey with you, learning a little bit more about the lens, even as you describe it, as they're in your eyes. It's been great.
Yeah, and I've learned a lot as well.
Yeah, thank you.
Thank you.